What is going on, everybody? Dr. Frank Garza here with Pure Physical Therapy and Pilates, where we deliver wow experiences with exceptional outcomes. And today I just wanted to come to you with a quick message. And this message is for all my coaches out there getting ready for the fall season, as well as all our athletic trainers out there. Before I go into the details of the message, I want to just say good luck in the season, and everyone, stay safe out there. And most importantly, just want to share with you some things to look out for, or things that maybe you need to kind of assess and see if physical therapy is right for any of your athletes out there. Now, as you know, we're going into the fall season, which means a lot of sports are acting up right now, or kicking back up right now. A lot of football practices are going on. First scrimmages are this Friday, so good luck to all my football coaching buddies out there and their staffs. I know they've been preparing really well to get this season started, but with that comes injuries, right? And unfortunately, injuries happen all the time. And I want to talk to you about some of the most common fall injuries that may occur, and maybe some of the things to look out for to indicate whether or not physical therapy is right for your athlete at the time. So the first one I want to talk about is your basic stress injuries, whether that be a stress fracture or a very severe sprain of some sort, in other words, damaging a ligament, or more stress than needed to a bone, causing some sort of fracture. Obviously, athletic trainers are well versed and trained in identifying those injuries on the field. That's why they're there. They're our home front when it comes to identifying these type of injuries. And for the most part, the rehab is pretty simple for your common ankle sprains and knee sprains and stuff like that are maybe your grade 1 and 2s, your something with not a lot of swelling, and something that they can kind of get weight bearing pretty quickly. It's just weak and unstable. Of course, if there's an incident where you do have somebody with a severe sprain, obviously he's gotten checked out by the doc, and says it's cleared to get started in rehab, but you're maybe having some trouble getting them back as quickly as you would like. Then of course that's where reaching out to your local physical therapist is beneficial, to see what kind of plan you guys can get together to increase the outcomes a little faster, whether that's by using the sports pump to reduce swelling, which we have at Pure Physical Therapy and Pilates, using the Class 4 laser, which we're only one of the only ones that have it down here in the Valley, which also reduces pain and inflammation to any injury site, or dry needling, cupping, massage, effleurage to decrease the swelling, compression therapy, or any just type of recovery training. Sometimes you have these athletes that they'll play on Fridays, and then they'll be super sore on Saturdays, right? Don't have any sprains or injuries, but just can't. It takes them 2-3 days to recover, to get back to practicing full strength, and then by that time it's midweek, and then they got to play again, right? So if you need somebody to recover quickly, we got some great innovative modalities for that in the sports pump. It's a compression ice kind of therapy, right? So that's available. And of course, if you just can't get the athlete, to do as much of the exercise as needed, or he just needs a little bit more accountability and one-on-one stuff, that's again where we come in, because that's what we do, every hour of the day from 8 to 7 on a daily basis throughout the week. So those are your stress fractures. Other obvious injuries to look out for are your concussions, which again, athletic trainers are, trained enough to identify that it's a possible concussion, and obviously they need to go seek medical attention. If it gets missed, but for some reason, you're watching film, you see the next day that they're complaining of those concussion symptoms of irritability with light, and maybe some dizziness, or headaches, stuff like that, blurred vision, and can't remember some of the stuff, or is having trouble recalling some of the stuff from yesterday. Obvious signs that may be a head injury and needs to get medical attention. And so you send to the most appropriate. I know that there's MDs, in this time of the year that open up, clinics on Saturdays for these special cases and stuff like that. So, the advice there is to not let it go, to Monday. Take care of it, as soon as possible with something like a concussion. And then you have your typical back injuries, your sprains and strains, instabilities, your neck, spasms, back spasms, stingers, things like that, from your hard hitting and just playing football. And I'm talking about football injuries, but there's not to say that the back sprains and back spasms can't happen in any other sports. So, things to look out for there are them complaining of, increased knots in some of those areas, and, for athletic trainers and palpating those muscles if they're in increased tone, and what can you do? Well, the typical e-stim and all that can definitely help, but dry needling is a definite very quick um, intervention to take care of spasms, and take care of tension, increase flexibility, relax the muscles. And believe me, there's a lot of athletes that have tight muscles that are overlooked because it's not necessarily painful, but that doesn't mean that they're not able, but it doesn't mean that they're functioning at 100% either, right? So, and again, other things that can happen are your for the younger athletes, are your growth plate, injuries, Osgood-Schlatter's, in the knee, and then you have the other one in the ankle that I'm throwing a brain fart on, but there's there's those injuries, and so what do you look out for there? Well, you look at their age and their activity, and if they've been doing a lot with no rest, and they have inflammation in those areas, that's probably something that needs, again, medical attention, and go to the rehab and therapy to kind of take care of that. But the one that I really want to talk about that I think gets overlooked a lot, not because it's purposely overlooked, it's just that the symptoms sometimes are just not there for coaches and trainers to refer out, right? And this is your athlete that practices, plays, and then takes a while to recover, but then can't practice because of like a minor ache or pain or injury, or says something hurts. And for instance, it's a hip and it only hurts with certain motions, and it's always a dynamic explosive motion or something, and it can't really be reproduced in practice. They can go, and then game time comes, they may feel it during the game, but they play through it, and then it's just there. This may be the athlete that has had a lot of history of injuries throughout their high school career. Maybe they're a senior and they've had these injuries always at the same time throughout their year, but then it goes away, right? So these type of injuries, are take a little bit more evaluation. They're a little bit more take a little bit more in-depth evaluation in terms of the mechanical nature of their movements, the passive mobility of every single joint in their body. Whether if you're examining the hip, that's the hip. If you're examining the spine, then you're looking at every single vertebrae, and looking for alignment, and looking for asymmetries in motion, asymmetries in muscle tone, asymmetries in tightness. All things that, when put under a high level of stress, are going to give the athlete or you some signs of dysfunction, whether that's pain, whether that's he held up on something, or you notice that they're doing something different. Well, that athlete there absolutely needs a evaluation in functional movement, and that's FMS, and we're certified in functional movement screenings, which is a combination of assessing several movements. One starts with the squat or the deep squat, and then there's other other motions that are incorporated in there, reaching behind your back, reaching in front. There's a balance test that's also done, and so it's scored very uniquely on a scale of 1 to 3. And each number tells us something about your ability to do that particular function and what needs to be done so that you are able to do it if in fact you can't do it, right? So it's pretty cool. Not every one of your athletes can benefit from it. Doesn't have to be somebody with pain. However, if somebody does have pain, this will definitely help identify the areas of dysfunction, and then we treat them by prescribing our innovative exercises that we have, accompanied with modalities or any manual therapy mobilizations that we've studied through our extensive fellowship trained courses. Then we do that, but the outcome is that the athlete returns to sport better than ever with less pain, is able to practice more, perform better, have better outcomes, etc. Right? So just kind of wanted to come on and let all the athletic trainers know that we are available. Pure Physical Therapy and Pilates is available to screen any of your athletes, whether on site or at the clinic. All you have to do is reach out to us. Go to our website, go to our Facebook page, reach out to us, and let us know. You can message us on Facebook, message us on Instagram, and we'll go out and do some visits. Also, for your Weslaco independent school districts, we'll be in Weslaco here soon, 810 East A Street or 1810 East A Street, something like that. But it's right there next to Weslaco East High School. And so we'll be there and offering functional movement screenings as well. So if you're interested in a functional movement screen, you don't have to be hurt to do it. All you got to do is contact us and we can help you with that. And then again, for those going through sports, just make sure you stay hydrated. Make sure you're doing something on the side other than what you're demanding or what they're demanding of you at school. And what I'm talking about that is recovery. Make sure you're eating well when you're not practicing and playing. Make sure you're doing some stretching, some foam rolling, and flexibility type stuff, aside from the grind of everyday practice. Because your body has to be well balanced and well flexible to be able to perform at a high intensity or a high level. So if you're wanting to learn more about functional movement screens and what we do at Pure Physical Therapy and Pilates, just contact us and let us know. And if you're wanting to get involved with improving your movement and your function to better perform at sports, let us know. We do that as well. And we're here to help. So stay pure Physical Therapy and Pilates in McAllen, Texas, and Weslaco, here to serve you and all your needs for all the young adults and athletes and everybody in the community that needs our help. Stay pure.